Bismillahirrahmanirrahim. So we were discussing about the chronic gastritis. In the previous lecture, we discussed about chronic gastritis associated with H. pylori, and today we will discuss about the autoimmune gastritis. It is less than 10% cases of chronic gastritis. So 90% of the chronic gastritis that is caused by H. pylori, and 10% is caused by autoimmune gastritis, and body of stomach is mainly involved. In H. pylori, the antrum was the most common site, whereas in autoimmune gastritis there is a body of stomach involvement, and there are antibodies to parietal cells and intrinsic factor. So intrinsic factor is also not secreted by parietal cells, and there is impaired absorption of vitamin B12 in the ileum, and this may lead to pernicious anemia. And there is hypergastrinemia and reduced serum pepsinogen 1 and enteral endocrine cell hyperplasia. And there is defective gastric acid secretion. So pathogenesis of autoimmune gastritis, there is loss of parietal cells, and there are autoantibodies against the parietal cells. There are CD4 positive T cells, which are directed against the nitrogen potassium ATPase pump. So loss of parietal cells, and due to antibodies against the parietal cells, there is less secretion of acid. So the morphology of H. pylori autoimmune gastritis, there is diffuse mucosal damage of the axanthic mucosa in the body and fundus of stomach. So there is diffuse atrophy, and mucosa is thinned out. The rugal folds, they may be absent, and the epithelial cells, they show regenerative changes, that is nuclear enlargement, and there is inflammatory cell infiltrate in the lamina propria. Small surface elevations may be due to intestinal metaplasia. So this is the microscopic appearance of autoimmune gastritis. Mucosal folds atrophy and subepithelial, lymphocytic, and macrophages infiltration. So clinical features of autoimmune gastritis: patients are of older age group, and females, they are more commonly affected than the males. There may be symptoms of anemia, that is dyspnea, paler skin. There is atrophic glossitis, and due to vitamin B12 absorption impairment, there is peripheral neuropathy, sometimes spinal cord lesions, and cerebral dysfunction as well. So let us compare the H. pylori associated gastritis and autoimmune gastritis. So location: in case of H. pylori associated gastritis, most common site is antrum, while in autoimmune gastritis it is body of stomach. Inflammatory cell infiltrate, neutrophils, and subepithelial plasma cells in H. pylori gastritis, and lymphocytes and macrophages in autoimmune gastritis. Acid production is increased or sometimes slightly reduced in H. pylori associated gastritis, but it is markedly decreased in autoimmune gastritis. Gastrin level is normal to decreased in H. pylori associated gastritis, and gastrin is increased in autoimmune gastritis. Other lesions which may be seen, there are hyperplastic or inflammatory polyps in H. pylori associated gastritis, and there is neuroendocrine hyperplasia in autoimmune gastritis. And if we do serology of these patients, there will be antibodies to H. pylori and H. pylori associated gastritis and antibodies to parietal cells in autoimmune gastritis. Complications: peptic ulcer, adenocarcinoma, and maltoma or malt lymphoma in H. pylori associated gastritis, and atrophy of the mucosa, pernicious anemia, adenocarcinoma, and carcini. So they are the complications in autoimmune gastritis. Then the association, that is associated conditions, poverty and rural areas, they are more commonly associated with H. pylori associated gastritis, while other autoimmune diseases like Sjogren's syndrome, Hashimoto's thyroiditis, so they are associated with autoimmune gastritis. Then there are certain uncommon forms of gastritis like reactive gastropathy, eosinophilic gastritis, lymphocytic gastritis, and granulomatous gastritis. So reactive gastropathy, there is glandular regenerative changes, and there is foveolar hyperplasia, and the common causes, they are chemical injury, non-steroidal anti-inflammatory drugs, bile reflux, and mucosal trauma. Then gastric antral vascular ectasia and watermelon stomach. So there is artery not branched properly, and diameter may be up to 3 millimeter. And this lesion is called Lafayette lesion. Then complications of chronic gastritis: peptic ulcer disease, mucosal atrophy, intestinal metaplasia, dysplasia, and gastritis cystica. So peptic ulcer disease, risk of peptic ulcer disease is 10% in males and 4% in females. There are about 3 million people affected annually, and the pathogenesis of peptic ulcer disease is imbalance of mucosal defense mechanisms and damaging forces. So H. pylori infection, non-steroidal anti-inflammatory drugs, gastric hyperacidity, corticosteroids, smoking, alcohol, all are predisposing factors for pathogenesis of peptic ulcer disease. So the risk factors I mentioned in the previous slide: H. pylori, non-steroidal anti-inflammatory drugs, gastric hyperacidity, corticosteroids, smoking, alcohol, chronic obstructive pulmonary disease, psychological stress, endocrine cell hyperplasia, Ringer-Ellison syndrome, viral infections like CMV and herpes simplex virus. So all are the risk factors. So morphology of peptic ulcer disease. So grass appearance. The site of peptic ulcer disease is the proximal part of duodenum, and lesser curvature of stomach. And these are sharply punched out ulcers or defect with smooth base, which may be shallow or deep. If the margins are heaped up, they are usually malignant ulcers due to adenocarcinoma. So this diagram shows the histology of peptic ulcer. This is the necrotic area, that is granulation tissue. This is granulation tissue. These are the inflammatory cells, and this is the stroma. So clinical features of peptic ulcer disease. These patients, they present with epigastric burning or aching pain, complications like iron deficiency anemia, hemorrhage, and perforation. And they often present with nausea, vomiting, belching, or weight loss. So what are the complications of peptic ulcer disease? As I said, bleeding from an ulcer, and there may be perforation, there may be obstruction of the duodenum. So that is about the gastritis and peptic ulcer disease.